Pharmacology friends, I am honestly shocked that I have never done a talk on alcohol. That is my area of expertise. I did my dissertation on alcohol pharmacology and its effects. So let's get into the pharmacology of alcohol. The type of alcohol that is present in the drinks like wine, beer, and spirits, or different types of liquor, are known as ethyl alcohol. And when there are two carbons present in a structure, that makes the substance ethyl alcohol, and that's the only one that you should drink. There's definitely other types like isopropyl alcohol, also known as rubbing alcohol. That one you're not supposed to ingest. It can cause some damaging effects like blindness when ingested. Ethyl alcohol won't necessarily cause those effects, at least in the immediate. So it's a simple two-carbon molecule with a terminal hydroxyl group. And these two aspects of its structure make alcohol a really soluble substance. And if you don't remember what soluble means, it means dissolvable in. So some things dissolve in water. So if you think of a Kool-Aid packet, if I dump Kool-Aid powder into water, it dissolves. If I dump a Kool-Aid packet into olive oil, the packet will just sit on top of the olive oil. It doesn't dissolve into that. So some substances are either soluble in water or fat, and sometimes both. Alcohol is one of those substances that can dissolve in both fat and water. So our body is made up of a ton of water, so alcohol can dissolve and accumulate in the watery spaces of the body. And that is a property given to it by this terminal hydroxyl group. The two-carbon structure is what allows alcohol to also dissolve in fat. And the fat component is important because when we think about what our cells are made out of, the membranes of cells are made up of phospholipids, lipids meaning fat. So generally, when something has a carbon chain, it's not able to dissolve through fat. Because this is such a short two-carbon chain, that gives alcohol the ability to easily dissolve through membranes. So not only can alcohol move through various channels to get through cells from the outside to the inside, it can also, because of its small structure and its hydroxyl group, dissolve right through barriers. And that becomes really important when we think about how alcohol is going to get inside of the body. So let's talk then about absorption of alcohol into our physical body. So generally, when I'm talking about alcohol ingestion, I'm referring to oral ingestion or drinking alcohol. Alcohol is certainly put into the body in other less common ways. Some people do snort it intranasally, which is something that hurts quite a bit. You have a ton of pain receptors up there, and that's going to sting. There's also rectal administration of alcohol that has been rising in popularity. And that is referred to as butt chugging, which is just what it sounds like. And maybe we'll touch on that a little bit later, but that is a dangerous way to ingest alcohol. So let's just go with oral administration or drinking of alcohol. So when we think about somebody ingesting alcohol, they're going to swallow it and it's going to go down their throat into the esophagus and eventually make its way into the stomach, which I just labeled there with an S. Now, from here, there are two possible scenarios. Either there is food present in the stomach or the stomach is empty. At the bottom of the stomach, which isn't labeled in this picture, but there is a valve or a sphincter that holds contents in the stomach. That ring of muscle is referred to as the pyloric valve or the pylorus. And the pylorus is generally relaxed. So if there is a scenario where there is no food in the stomach, The alcohol would go down the esophagus into the stomach, and because there's nothing in there, the pylorus is relaxed, meaning that the alcohol can go right through an opening at the bottom of the stomach. It can dump then right into the small intestines. And the intestines are generally where things are absorbed anyway. So the alcohol will start filling up the area of the intestines. And because things in the body move from high concentration to low concentration, we will see the alcohol diffuse through the walls of the small intestine into the bloodstream, because concentration of alcohol will be high in the intestines and low in the blood. Moving from high to low concentration like that is just called simple diffusion. When there is no food in the stomach and alcohol moves very quickly from the intestines into the bloodstream, that leads to pretty high levels of alcohol that are detected. This BRAC, that stands for breath alcohol concentration. So when we have somebody blow into a breathalyzer after drinking on an empty stomach, they achieve a lot higher of a breath alcohol concentration, and they report higher levels of intoxication. An interesting thing, though, about the body is the faster something gets in there and the higher the dose, the harder the body works to get rid of it. So breath alcohol concentrations go up really high initially, but the body does work to bring the breath alcohol level back down to normal pretty quickly. Now, then, the other scenario would be if alcohol was ingested when there is food in the stomach already. When there is food in the stomach, that means the pyloric valve is closed. In order for you to break down your food efficiently, the stomach can't be squeezing whatever is in there too hard, because if it does, it'll just get dumped into the intestines and will start to try to absorb whatever is in there. So it's important that the pyloric valve be closed in order for food to be broken down. In this case, that means after the alcohol is ingested through the mouth, swallowed, and going down the esophagus, it will land into the stomach, but rather than emptying out immediately, it is held in place by virtue of the pylorus being closed. That means that the alcohol will remain in the stomach and then empty out along with any food. And the rate at which food leaves the stomach is called the gastric emptying rate. And if you've ingested something that's really high in carbohydrates but low in protein and fat, it usually is about an hour for the stomach to empty that out. However, if you've eaten a meal that's high in protein and fat, it can take up to 3 hours for the stomach to empty. So if somebody is drinking on a full stomach, if they've had a really high fat, high protein meal, that means the alcohol will be in there for a couple of hours. That's going to lead to lower levels of detectable alcohol. So we don't see that big spike in blood alcohol leading to a breath alcohol concentration that's higher. So instead, the alcohol will slowly make its way into the small intestine, where it will be absorbed too by passive diffusion into the bloodstream. So we don't get this really high level of alcohol. It's leveled out. But that also means because it's getting in slower, it's going to be removed slower. So the alcohol persists in the body for longer. One other thing we do have to mention is that because alcohol is fat soluble and our cells are made out of this fatty substance, well, alcohol is in the stomach. Some of it can actually cross the gastric barrier or the lining of the stomach itself. That means that things can directly be absorbed through the stomach. Very few things in the world can actually cross the gastric barrier, and alcohol is one of them. If there is no food in the stomach, we never have to worry about that. It's only absorbed through the intestines. It's only when there is actively food in the stomach that alcohol will take its chance to absorb right through the stomach wall. In the immediate, that lets alcohol enter the bloodstream relatively quickly. and lead to these immediate effects of intoxication where people report that they feel the effects of alcohol within a couple of minutes. However, over long-term use, we see that alcohol really badly damages the gastric lining and can cause inflammation of the stomach lining. It's called gastritis. So we want to avoid doing that over the long term, but because of the slowing effects of drinking with food, that's usually what is suggested to people who do ingest alcohol. They'll say, have a glass of wine with dinner. What they're encouraging that person to do is drink at a level where the intoxication comes on more slowly. The slower something gets to your brain, the less likely it is that it causes a reward. And we'll get more into that later. So just to sum up, alcohol is absorbed from either the intestines or the stomach, or both, just through simple diffusion from the GI tract into the bloodstream. Once a substance is brought into the bloodstream, it will then level out in concentration in all parts of the body. So at all areas, all tissues of the body, that substance should be in equal concentration. And we call that full distribution. Because alcohol is soluble in both fat and water, it can distribute in places quite quickly. The small blood vessels called the capillaries out in the body, when we're dealing with just systemic capillaries, so things that aren't in the brain themselves, they are generally very leaky. They're one cell thick, and the space between those cells that make up a capillary, called endothelial cells, those spaces between them are relatively large. Because alcohol is such a small substance, it very easily can slip through those spaces between the capillary cells. And in order for a drug to work, it has to make its way from the bloodstream into the parts of the body that will be affected by it, right? So in the systemic parts of the body, alcohol travels very quickly into the tissues through these endothelial junctions, these spaces between capillary cells. In the brain, capillaries look a little bit different. The spaces between the endothelial cells that make up capillaries are really tight. They're called tight junctions, and it's hard for things to make it through there. In addition to this, we also have these brain cells called astrocytes that put their little feet on the walls of capillaries to make a further barrier that we call the blood-brain barrier. So the blood-brain barrier is this extra layer of protection in the brain so that not every substance that we ingest can actually make it from the bloodstream into the brain tissue, because it would have to make it through these tight junctions and through this astrocyte. Lucky for alcohol, it is soluble in fat, so it can dissolve right through the phospholipids that make up the membrane of all of these cells in the body. It can make its way through the cells of the capillary, and it can make its way right through the astrocyte as well. So alcohol moves into the tissues of the body very quickly, and it can also very quickly move from the bloodstream into neural or brain tissue. One other thing that is important with regards to distribution is the issue of body water. So what this over here is showing you is the body water differences in biologic males and biologic females. Alcohol accumulates in the watery spaces of the body. And one difference that we see physiologically between males and females is a difference in body water. Males anatomically have more body water than females do. What this means is the same amount of alcohol will accumulate differently in the male and female bodies. So males have 68% body water. So when they ingest one drink, that alcohol will be dissolved in all of this water. Females tend to have more body fat and less water, so when they ingest that same drink, there's less water for it to dissolve in. The way I like to think about this is like a bathtub. That looks good. There's somebody in the bathtub. So if you picture the bathtub full of water and you're dumping a bottle of vodka, this looks great, a bottle of vodka into that bathtub, if it's a full bathtub of water, that's like the male body. There's a ton of water for that vodka to dissolve into. Whereas the female bathtub would only be about 3/4 of that. So when you dump that bottle of vodka into that bathtub that's not as full, there's less water for it to dissolve into. So it's going to stay in a higher concentration. So that difference in body water is a large driving factor behind the differences in intoxication between males and females. If you look at drinking guidelines, they're always going to be less for females than males. That is because of this big body water difference. It is going to stay in a higher concentration in female bodies. There is another enzymatic difference that's, again, relatively minor, but there is less amounts of gastric alcohol dehydrogenase, which is a specific enzyme that's only activated when we're actively absorbing alcohol through the walls of the stomach. So females can break down alcohol less effectively when it's absorbed through the stomach than can males because of the lesser amount of this special enzyme. So that means with distribution, alcohol is easily distributed in all tissues in the body, including brain tissue, very quickly and efficiently because of its solubility. And it also is going to be in higher concentration in females who have less body water available to dissolve that alcohol. So they will reach higher levels of intoxication ingesting the same amount of alcohol as a male. All right, so we went through absorption and distribution. So the alcohol came in, it's in every tissue in the body where it can then exert its effects. Once something is in the body wants to get rid of it immediately. And in order to get rid of things, it has to break it down. And that process is called metabolism. So the metabolism of alcohol is a special type of metabolism, but it is going to follow the same principles of metabolism in that whatever comes in has to eventually go out. Like most other substances, the liver is going to be the organ that breaks down alcohol, and it is going to do so by utilizing a specialized enzyme. When we think about things being broken down by the liver, there is this really large family of proteins called the cytochrome P450s, and alcohol uses that system to a negligible degree. It does utilize an enzyme referred to as the cytochrome P452E1, but not to a large degree. It mainly utilizes an enzyme called alcohol dehydrogenase. And what alcohol dehydrogenase does is convert ethanol. Here's our alcohol dehydrogenase, or ADH, that converts ethanol into a byproduct called acetaldehyde. And this process happens right in the cytosol, or the watery space in a cell. So if we're looking at a cell, it's got its nucleus and it's got all of its little cell parts. That watery space that everything is floating around in is the cytosol. So that's where ethanol is converted by ADH into acetaldehyde. Then, in the mitochondria of the cell, which we mainly think of as our ATP energy centers, the mitochondria contribute a second enzymatic reaction. In this area, there's a second enzyme called acetaldehyde dehydrogenase, and this converts our first byproduct, acetaldehyde, into our final product that we can excrete out of the body called acetate. And that's the whole deal with metabolism. We can't remove most things in the body as they are. We have to change them into a form that we can excrete. And we excrete most of these byproducts through urine, meaning that the kidneys are going to help in the excretion process of this. So about 90 to 98% of alcohol goes through this process of being converted into acetaldehyde and then acetate, which is then excreted through mainly the urine in the body. So notice I said 90 to 98% of alcohol is metabolized in this way and then excreted through the urine. Well, what about the rest of the alcohol, that other 2 to 10%? What happens to that? Well, that small amount of alcohol gets to leave the body unchanged, meaning it is not altered at all. Rather than being broken down by alcohol dehydrogenase, pure old ethanol, so just pure ethanol, is excreted through the lungs, so through exhalation, and then through the skin when we sweat. So that actually gives us the basis for a breathalyzer test. When somebody blows into a breathalyzer, we're actually able to measure pure ethanol, because it is contained in the water that we breathe out. And if you've ever sweat or worked out next to somebody who smelled like a brewery, what you were smelling is actual alcohol. It comes out of the pores and it comes out of the lungs. So we've got excretion here by the urine and through the lungs and through sweat. So that's a fun thing. The other thing that I should mention about excretion and elimination has to do with the kinetics, or the movement of alcohol out of the body. So alcohol moves out in a specific way that is different than most other drugs. And we're going to look at it now. Surprise, there's more information here. So when we're thinking about alcohol being metabolized down this pathway, one thing that differs between this pathway and the cytochrome P450 pathway is the amount of enzyme. With the cytochrome P450 system, there are tons and tons of those enzymes available, meaning when the drug goes into the body, those enzymes get to work breaking it down very, very quickly, and that gives us a very predictable timeline for the drug to leave the body. And it usually looks like this in a curve, and that's referred to as first order kinetics. And something about first order kinetics is that that drug then has a half-life, meaning we know how long it takes for a certain percentage of that drug to leave the system. So alcohol doesn't work that way. Rather than having this whole group of enzymes that are available to break it down, there's only so much alcohol dehydrogenase available. So rather than being removed very quickly, alcohol in each person, it doesn't matter who you are, male or female, there's no differences that we've detected in ethnicities. There is enough ADH to get rid of about 1 to 1.5 drinks per hour. It is a constant amount of alcohol that's eliminated. And that will end up looking like this straight line. We call that zero order kinetics or zero order elimination. So there is no half-life. It really is just a battle between how much somebody has drunk and how much alcohol dehydrogenase there is available to break that down. I like to use an example of shopping and checkout to help this make a little bit more sense. So if we think of the enzymes in the liver metabolizing something so it can be moved out of the body, picture the enzymes as cashiers at a store, so at Target or something. So when you go to Target in the middle of a Tuesday at like 11 a.m. because you're not in class, you decided to go buy some stuff. When you go to check out, there's a ton of cashiers available, and you can pick whatever line you want and you get out very quickly. That's like most other drugs in the body. There's tons of enzymes available and they get shuffled through very quickly. Whereas alcohol, that's like you going to Target on Christmas Eve. There are not very many lines open because people have off for the holiday. There's a ton of other people in line in front of you, and you just have to wait your turn. So it's going to take a lot longer. You're still going to have all of your items scanned. You're going to pay for them and you're going to check out, but there's not as many cashiers and it's going to take way longer. That's what I want you to picture for this system. There is a small amount of alcohol dehydrogenase that's available. So if somebody is drinking at a level over 1 to 1.5 drinks per hour, that means that this process is going to happen very slowly. Your body can only do that amount of elimination per unit of time. That also means that the drug's effects are going to persist in the system for a lot longer if there's a lot that's taken. So those are some things to keep in mind about alcohol. It is broken down by this specialized enzyme system. It's not typical of the other systems in the body that break down other substances. It is time dependent, and we can only break down about 1 to 1.5 drinks per hour. So we metabolize and excrete at a steady state. All right, one final thing I want to say about this is the pathway and then drugs that can interfere with this system. All right, so when alcohol is broken down into acetaldehyde by ADH, when acetaldehyde builds up in the body, you start to feel kind of nauseous, a little light sensitive, like your head hurts really bad, your face tends to flush, you're uncomfortable. If that sounds like a hangover, that is exactly what we're talking about. When we don't break down acetaldehyde at a good rate, it builds up in the bloodstream and we have this aversive reaction to it. So really what a hangover is at its very core is a lot of acetaldehyde that's built up in the body. In order for acetaldehyde to go away, we have to have the second enzyme, acetaldehyde dehydrogenase, break it down into acetate. There is a medication on the market called disulfiram or antabuse, disulfiram, and that is given to people who want to stop drinking for whatever reason. And the disulfiram, sold as antabuse, blocks this enzyme so that we don't convert acetaldehyde into acetate. So that when somebody starts drinking right away, they start to feel these aversive effects of alcohol, which are presenting as an accumulation of acetaldehyde. That's called an aversion type of therapy, where somebody will eventually start to pair that bad feeling, that aversive feeling, with ingestion of ethanol. The other thing that you might be familiar with when we talk about that flushing, that aversive feeling when somebody first starts to ingest alcohol, is the fact that some populations have that effect almost immediately, and they tend to have low rates of problematic drinking. So that enzyme, acetaldehyde dehydrogenase, so that's an enzyme. It's a protein. We make proteins in our body. If we make them, we need a recipe for it. Where is our recipe book? It's in the DNA. It's encoded in our genetic information. So there are some populations, Native American, Pacific Islander, Asian populations, where they have a polymorphism to that enzyme. It's called an ALDH2 polymorphism. And in those individuals, they have altered genetic expression of that enzyme, the ALDH enzyme. People with an ALDH2 polymorphism, they accumulate acetaldehyde very quickly in the same way that disulfiram causes that accumulation, so that they have that facial flushing and aversion to drinking almost immediately. So that is something that does have a genetic difference between individuals and by population. So finally, we talked about acetaldehyde as the aversive thing. It's associated with aversion to drinking and also hangovers. The last thing that I just want to tell you about for funsies is acetate. So if we think of acetaldehyde as your hangover thing, think about acetate as your early morning wake up thing. So if you recognize the name acetate, that's the main ingredient in something like nail polish remover, which is a poison. We're not supposed to drink it. We have a brain area who's responsible for monitoring poison levels in the blood and then waking you up and causing vomiting so that you can get rid of that poison. When there isn't sufficient excretion of acetate, it builds up as a poison, and that area of your brain will wake up the rest of your brain to alert you to the fact that you just ingested a bunch of poison. Why are you sleeping right now? If you drank 12 beers and think you're going to sleep forever, if there's a high amount of acetate, your brain's going to wake you up. So we've got acetaldehyde driving hangovers, and acetate is a large driver for early morning wake-ups.